The lungs in Latin pneuma and pulma. Who have a gloss? One, maybe glow. About lungs, in Russian lungs.
Latin name.
Russian.
Latin.
Yo. You know we have two. We have ye and yo. It's different.
Yo with two dots.
Yes, with two dots.
Two dots.
Yes, легкие. Yes. In Latin, pneuma and pulma. Yes, pulma and pneuma. So the diseases in Russian pneumonia. Inflammation in the lungs. Pneumonia in Russian language is called. So the lungs. This is a paired organ located in the thoracic cavity, and have a bag. It's called a pleura. And between two pleura located the mediastinum, anterior and posterior. Mediastinum. This is a complex of organs. It can be organs, vessels, mediastinum, anterior and posterior. So if we say about lungs.
छोटा लंग्स बच्चे का नहीं बड़ा नहीं देखा तुमने पिछले क्लास में इतना बड़ा लंग्स आया
Say
These lungs are of adult or child?
maybe no, I think adult. Maybe girl lungs. Lungs can be small.
लड़कियों के
मैंने वो दिखा लास्ट ठीक है लेकिन दिखा तो
सबके अलग होते हैं अरे body size
Lungs have the gray pink color. Who smoke? Unfortunately, yes. Firstly, it's making like patches, and then all lung is black. Who smoke? Not?
No.
Smoking.
All good people.
good
Хорошо.
This is so. If we say about lungs, this is correct position of lungs. So lungs have apex, pulmonis looking up, and if we turn, we can see the basis pulmonis. 1, 2. Yes, basis pulmonis, and then apex pulmonis. And lungs have free surface. Facies costalis. This is between ribs. Yes, connecting. Facies costalis. Then facies diaphragmalis. Yes, because diaphragm located below. And facies mediastinalis. No, medialis or mediastinalis, because what we say mediastinum located between two in this place, anterior, posterior, mediastinum, and the border between two mediastinum. This is a trachea. We're drawing the line. Anterior mediastinum, posterior mediastinum, free surface, costal, diaphragmatic, and mediastinalis. Yes, and you can see that right lung have in normal free loops. 1, 2, 3.
Right material, left material.
And left two loops. So when you put in correct position, yes, you look the right lung have three loops, the left only 2. So this is right side, this is left side. So this is correct position of lungs. Then if we say about lungs, we have anterior and posterior border, and on the facies mediastinalis we can see the hilum pulmonis, hilum pulmonis, and radix pulmonis. Radix pulmonis, this is bronch, artery and vein that enter and exit in the hilum pulmonis. And right and left is the different. If we say about right, BAV. Bronch, from upper to lower, bronch, artery, vein. And left, easy, ABV. Artery, bronch, vein. So the radix pulmonis different right and left lung. Right, BAV, BAV. And in left, A, B, V. Yes, like in the Russian, A, B, V. You know, there are A, B, V, G, D. How in English? Alphabet.
A, B,
Alphabet.
In Russian, it's alphabet, and in English,
Alphabet.
Alphabet.
LMLOP.
So, left, A, B, V. Artery, bronch, and vein. We have one artery, one bronch, but two veins. Two veins in right, two veins in left. Then, if we say about the fissures, we have, if we say about left, it's have only fissura horizontalis, and this lung have fissura horizontalis and fissura obliquus. Yes, horizontal and oblique. Yes, because have a free lobe. Yes, 1, 2, 3, 1, 2. Then, if we say about lobes, we say, and on them, what organ located near the heart? So, we have notch. This is cardiac notch. Incisura cardiaca. In this place, heart located. So this is cardiac notch. Incisura cardiaca. Ending the lingua pulmonis. Stop. 1 second. Yes, this is lingua pulmonis. This is incisura cardiaca, lingua pulmonis. This is about the left. And about structure, this is all, not a lot of. So, have the correct position, firstly, then have the different count of lobes, free right to left, have two faces, free faces, two border, apex, base have, and have the hilum pulmonis, yes, with radix pulmonis, right, B, A, V, bronch, artery, vein, left, A, V, artery, bronch, veins. Yes, understand? Yes. About structure, not difficult, I think, about structure. And then, firstly, it's lobe, and then they loops, and then they dividing to segments, to bronchi dividing trachea. Then, if we say about lung tissue, firstly, it's loop, and then inside, it's dilated to the segments. 10 in right, and 10 in left. In right, it's easy. Upper lobe 5 and lower 5. 5. Oh, sorry, left. Yes, 5. And this is 5, 2, 3 segments. 5, 2, 3. 5, 2, 3 segments. Yes, have segments. Then, let's say the same. If we say about what lungs have function? Gas exchange. Who know where located gas exchange? Alveolars. And now we discuss at the previous class bronchial tree we not discuss. No. So now we discuss firstly bronchial tree and then the alveolar tree, because we have two tree. Firstly is bronchial, only one function passes the air, and then beginning the alveolar tree, function gas exchange. And who know the unit of lungs? Acinus. This is unit of lungs called acinus. And acinus have a lot of alveolus where located gas exchange. Yes. If we look at the bronchial, if we look at the bronchial tree, firstly passes trachea. Yes, trachea. This is trachea. And then trachea on the level 5th thoracic vertebra dividing to two bronchi. Bronchus principalis dexter and bronchus principalis sinister. And then these bronchs dilated to the lobar lungs. Left have two, upper and lower. And if we say about left, firstly is have lobus, bronchus principalis, bronchus lobularis. If we say about left, this is upper and lower, and right upper and stem. And then stem dividing lower and middle. Understand? Yes. So the left at the first dividing to the upper and lower. So firstly, this is principal bronch, and then upper and lower bronch. But right, have a free loop. So firstly, it's dividing to the upper and stem, and then stem dividing lower and middle. And if we say about bronchial free, it's have a dividing to 2. So firstly it's 2, then 2, how D? It's called branches. Yes, branches. We say trachea, then principal bronch, then lower bronch, then going a segmental bronch. Then in right, then in left, then subsegmental, then interlobar, lobar, and then terminal. So terminal bronchioles, this is the last part of bronchial free. And if we look at the picture, this is terminal bronchioles. And then begin the acinus. This is acinus. Acinus, this is a unit structure of the lungs. Yes. Firstly, have alveolar ducts, and then alveolar sacs, looking like a grape. Yes. Looking like a grape. So this is acinus. Gas exchange located in the acinus. Firstly, have alveolar duct, and then alveolar sac. No, looking like sacs. You know what? Sacs. A million in the lung. So in this place located the gas exchange. So this is all of this bronchial tree only pass the air. So person who smoking, for example, if the smoke, yes, stay in the bronchial tree, it can passes back. This is not bad. But if smoke go to the alveolus, unfortunately it stay in this place. Understand? So why is danger? Because and this, yes, no cancer can be, and we have in Russian, I don't know how in English, the disease of smoking people, HOBL, the chronic obstruction disease of lungs. This is a smoking people, 20 or more years, have a smoking disease.
वो तो लंग सिरोसिस तो फैक्ट्री में जो काम करते थे
It's called if in English, no, not bronchitis. In Russian, obstruction, bronchial disease, chronic mean for life. Yes, chronic. HOBL. Emphysema, no, it's similar not emphysema. COPD. This is not emphysema. This is not emphysema. Emphysema can be smoking too. This is different.
इलास्टिसिटी खत्म हो जाती है ना एम्फिसिमा है ना फिजिक्स केमिस्ट्री नटका
So about bronchial alveolar free tree, it's not difficult, I think. No, lungs, for my opinion. Then, Then, if we say about the back of the lungs, it's called a pleura. Pleura is serous membrane like peritoneum, but peritoneum located in the abdominal cavity, and pleura located in the thoracic cavity covering the lungs. So we can do sheets, parietal and visceral. Parietal covering the walls of thoracic cavity, yes, and visceral covering the lungs. And between we have a cavitas pulmonis with the fluid, like peritoneum, reduces the friction. Then we have a pleural recessus, pockets. This is a space between two parietal sheets of pleura. Costa diaphragmatica. Then located between the ribs and diaphragm, costa mediastinalis, phrenico-mediastinalis. Phrenic, this is similar word like a diaphragm, yes. And vertebra mediastinalis, vertebral column and mediastinum, yes, and mediastinum. And skeleton of lungs percussion, you can at home It's only study.
Okay.
On the study, and you can see that right and left, they are different because left have heart near,
Cardiac.
so the colors different. You can make photo of this picture, use the information, yes, and you should know all lines and intercostal space, right and left lobe, and pleura that covering the lungs have a different skeletopy too. Yes, so this at home you what else? Skeletopy of pleura and mediastinum. Mediastinum. This is complex of organs located between the two pleura of lungs. We say anterior, posterior half. In anterior located the trachea, the heart with pericard, ascending aorta and aortic arch. Yes. Thymus gland and root of the lungs. And posterior esophagus, descending aorta, thoracic lymphatic duct, azygos, hemiazygos vein, and lymph nodes. No, this study, anterior and posterior mediastinum. Yes. No, at about lungs, this is called. Yes. So lungs, skeletopy, structure,